I'd like to introduce California Senator Dianne Feinstein, who has been a respected, independent, moderate voice in Congress for many, many years, which makes her advocacy on behalf of effective regulation of health insurance rates all the more important, because her colleagues on both sides of the aisle value that advocacy. She's introduced legislation in Congress along with Representative Schakowsky, and has lent her support to California's latest effort to effectively regulate health insurance rates and allow the commissioner to reject or modify excessive rate increases. So consumers are incredibly grateful for her advocacy on behalf of them to prevent unreasonable rate increases, and Consumer Watchdog just wants to thank you for taking the time today to come here and speak.
Thank you. Thank you. Appreciate it. Well, thank you very much for the introduction, and Harvey, welcome to the East Coast. It's great to have you back here. And to the commissioner, thank you very much for being here as well. I really feel very strongly about this issue, and I want everybody to know that. And it's a great concern because it determines the affordability of health insurance in this country. You know, no country in the world has reformed health care with a large for-profit medical insurance industry, and yet we are faced with one. In 1999, average premiums for family coverage, well, I should say since 1999, have risen 138%, while medical inflation rose just 31%. So essentially costs are running 3 times above inflation. In 2009, 57% of people attempting to purchase insurance in the individual market found it difficult or impossible to afford it. So the cost continues to rise, and all the while these insurance companies enjoy really unprecedented profits. For the first quarter of 2011, the 5 largest for-profit health insurance companies recorded a net profit of $3.9 billion. Now that's an average 16% above the same period the year before. Also, large insurance companies now insure 2.8 million fewer Americans than they did on December 31, 2008. An estimated 59.1 million Americans were uninsured in the first quarter of 2010. So costs are going up and coverage is going down. You may be interested to learn that even though rates are going up, the amount insurance companies spend on medical care is going down. So while profits and paychecks to the CEO have increased, the amount of money insurers paid out to actual health care went down. Something's wrong with this picture. The healthcare reform laws takes the first critical step to control premium increases and ensures that companies spend more on medical care, not profits. In other words, they have to spend 85% on medical care rather than the other administrative expenses. The law does not grant explicit authority to block or modify egregious rate increases. That's one of the problems with healthcare reform. And that's why I, along with Representative Jan Schakowsky in the House, have introduced the Healthcare Rate Review Act of 2011 to close this loophole. And the bill creates a federal fallback review process that grants the Secretary of Health and Human Services the authority to block or modify a rate increase, a premium rate increase, that she would consider to be egregious or unreasonable. So the Secretary can review rates when she believes they go too far. Now today, in 17 states, including my own California, state regulators, insurance commissioners do not have this authority. In some states, they do have the authority. So the legislation is really a simple, uncomplicated fallback for those states that can't do something to control rates. This is a mechanism for them to do so. I think everybody is familiar with the increases that Anthem Blue Cross was set to impose, as much as 39% for 800,000 policyholders in California. But Anthem was not an aberration. Insurance companies in California today continue to propose 30, 40, and yes, even 80% cumulative premium increases. Now, we're lucky. We have a very strong insurance commissioner in California named Dave Jones. And I really want to thank him for his good, proactive advocacy and the protections he's afforded to thousands of Californians from unjustified rate increases. But the bottom line is that he doesn't have the necessary authority to block unjustified rate increases. California Assemblyman Mike Feuer has introduced a bill called AB 52 that would grant California state regulators this authority. And I strongly support these efforts and hope that you will too. I have endorsed this bill. You may have heard about the recent rate hikes that a number of insurance companies were set to impose in California, and that's some as much as 80%. Insurance Commissioner Jones requested a delay of these increases until he had a chance to review them, and the insurance companies complied. After review and pressure from Mr. Jones, Anthem Blue Cross agreed to scale back planned rate hikes from 16.4% to 9.1% for 600,000 individual policyholders in the market, and to delay implementation of these rate hikes. But here's the catch. Anthem Blue Cross also serves policyholders through the Department of Managed Care in California. For over 120,000 Californians that receive their Blue Cross insurance through the Department of Managed Care, rates rose 16% on May 1. The department deemed these increases unreasonable, but they don't have the authority to block the increase. This means that the same company scaled back rates for some individual policyholders, but not others. How, I ask, does that make any kind of sense? So the bottom line is we need help in California. That's one of the reasons why we did this bill, in addition to obviously benefit others as well. I can give you personal stories, but I won't do this now. My conclusion is this, that after watching the medical insurance industry for a substantial period of time, I've come to the conclusion that it's really bottom line oriented, much more so than the provision of the most cost-effective insurance they possibly can give to their payments. And that I'm convinced they reward their CEOs based on what they do for the bottom line of their company. My own particular view is that all of this should be nonprofit. It should not be for-profit. People shouldn't make money off of this kind of thing because it so affects people, and we've seen uninsured go from 40 million to 56 million. Why? Because people can't afford the cost of the insurance. So I want to thank everybody. I mean, this is a heavy burden. The industry lobbies very, very effectively, and it's enormously difficult to get traction on this issue in a legislative body because they just duck you one way or another. So I think we need a few firebrands on the scene, and hopefully there's some firebrands in this room. I know of at least one who shall be nameless. But firebrands arise. We need to help because you can't have a medical insurance industry that people can't afford to purchase insurance from. And I'm afraid that's where we're going. So thank you very much, and I appreciate being here, and please support our bill. Thank you. Thank you.
Thank you again, Senator, for taking the time and for your strong advocacy for consumers.